Have you ever wondered, should I get circumcised as an adult? Is it actually beneficial? Is it risky? Will it affect my sex life? These are some of the most common and, honestly, most misunderstood questions I get. So today, we're going to break it all down. I'm Dr. Ella Reed, and in this video, we're going deep into the real medical reasons for circumcision, the actual benefits, and risks, the biggest myths, especially about sensitivity, and what you can realistically expect if you choose to have the procedure. And just to be clear, this video is specifically about adult circumcision, not infants or children. Let's get into it. Brain, what is circumcision? Circumcision is a surgical procedure where the foreskin, the fold of skin covering the head of the penis, is removed. Some men have it done in childhood for cultural or religious reasons, but others consider it later in life for medical, functional, or personal reasons. Pushpin, why do adults get circumcised? There are three main medical reasons. 1. Lichen sclerosis, skin condition. This is a chronic skin condition that can cause white patches, scarring, tightening of the foreskin, painful urination over time. It can make retraction difficult or impossible. In these cases, circumcision can be definitive treatment. 2. Balanitis, inflammation or infection. Balanitis refers to inflammation of the foreskin and glands. Symptoms include redness, irritation, pain, discharge. It's often linked to poor hygiene, diabetes, tight foreskin. If it keeps recurring, circumcision can significantly reduce future episodes. 3. Paraphimosis, medical emergency. This is when the foreskin gets stuck behind the head of the penis and cannot be pulled back. This causes severe swelling, pain, restricted blood flow. Backhand index pointing right. This is an emergency. If not treated quickly, it can damage tissue. In many cases, circumcision is required to prevent it from happening again. Receipt, other reasons, non-medical. Some men choose circumcision for cosmetic preference, hygiene, convenience, reduced risk of certain infections. Studies have shown lower risk of HIV transmission, reduced risk of human papillomavirus, HPV, very low risk of penile cancer. But it's important to understand, backhand index pointing right, these are risk reductions, not guarantees. Warning, risks of adult circumcision. Like any surgical procedure, there are risks. Let's go through them honestly. 1. Bleeding and swelling. Mild bleeding is common. Sometimes blood can collect under the skin. Hematoma usually resolves on its own too. Infection, rare, uncommon with proper care, treated easily with antibiotics if it occurs. 3. Cosmetic concerns. Some men are unhappy with how much skin was removed, the final appearance. That's why communication with your doctor is important. 4. Sensitivity changes. This is one of the biggest concerns. After circumcision, the head of the penis becomes exposed initially. It may feel more sensitive over time. It adapts. Sensitivity stabilizes. 5. Regret. This is the most important psychological risk. Backhand index pointing right, you need to be 100% sure before proceeding, because this is permanent. Microscope, does circumcision affect sex? This is the question everyone wants answered. Let's look at the science. Large systematic reviews and meta-analyses, which analyze dozens of studies, have examined erectile function, orgasm, quality, ejaculation, timing, overall sexual satisfaction. Backhand index pointing right, the conclusion? There is no significant difference between circumcised and uncircumcised men. Brain, what about nerve endings? There's a lot of debate online about this. Some claim the foreskin has thousands of nerve endings, removing it reduces pleasure. Let's clarify. There are specialized nerve receptors called genital corpuscles. These are responsible for erotic sensation, and they are primarily located in backhand index pointing right, the glands, head of the penis, not the foreskin. The foreskin does contain nerves, but they are similar to skin on your arm. Skin on your leg, they respond to touch, pressure, temperature, but they are not uniquely responsible for sexual pleasure. Balance scale, reality check. That said, your experience is personal. Some men report no change, improved comfort, or occasionally decreased sensitivity. All of these experiences are valid, even if large studies show no difference. Hospital, what happens during the procedure? Let's walk through it step by step. Step 1. Preparation area is cleaned thoroughly. Sterile draping is applied. Step 2. Numbing, local anesthesia. You'll feel A few small injections after that. Backhand index pointing right, you should feel no pain during the procedure. Some patients even fall asleep. Step 3. Surgery takes about 30 minutes. Foreskin is removed. Dissolvable stitches are placed. Person in bed. What to expect after surgery. This part surprises a lot of people. Yellow circle swelling and appearance. The penis will look swollen. It may look worse before it looks better. Backhand index pointing right. This is completely normal. Snowflake managing swelling. Ice packs wrapped in cloth. Frozen peas work well. Pill pain control, usually mild, managed with medications like ibuprofen, acetaminophen. Shower, hygiene shower. After 1 to 2 days, avoid baths for 2 to 4 weeks. No entry restrictions for about 4 to 6 weeks. No sex, no masturbation. Avoid heavy exercise. High voltage erections during healing, they may happen. Backhand index pointing right, totally normal. Backhand index pointing right, usually not harmful. Straight ruler cosmetic options. Some men ask, can I choose how it looks? To some extent, yes. Cut position. High cut further from the head. Low cut closer to the head. Tight versus loose. Tight, more skin removed. Loose, less removed. Warning, important. Too tight equals discomfort during erections. Too loose equals hygiene issues. Remain. Most surgeons aim for a balanced outcome. Receipt. Bottom line, let's simplify everything. White heavy check mark. Circumcision can help if you have medical conditions, recurrent infections, structural issues. Cross mark. It is not necessary for everyone. Many men live perfectly healthy lives without it. Balance scale. Sexual function. Backhand index pointing right. No strong evidence of negative impact. Overall warning, but it is permanent, so the decision should be informed, thoughtful, personal. Speech balloon. Final thoughts if you're considering circumcision. Don't rely on social media forums, fear-based advice. Backhand index pointing right. Talk to a qualified doctor. Understand your specific situation and make the decision that's right for you. If this video helped you understand things more clearly, make sure you subscribe for more honest, science-based health content every week. And as always, take care of yourself because you're worth it.